Hello, I'm Kathy Johnson, President of Sentara Northern Virginia Medical Center. It's my pleasure to be with you today to present this virtual introduction to mission, vision, and values at Sentara Northern Virginia Medical Center. I have been with Sentara since June of 2016. I came from North Carolina, even though I am originally from New York. You will find, as I did, I'm sure, that the team here is very committed to our patients and to each other, and they're an absolute pleasure to work with. So welcome to Sentara, and I hope you enjoy our presentation today. When I joined Sentara, I was intrigued to learn the meaning behind our logo, and I'd like to share that with you. The stylized S symbol represents the pathway to the future of healthcare, a pathway that Sentara will continue to lead through innovation, quality, research, customer service, and medical leadership. The gold corporate color sets us apart, exemplifying the gold standard of healthcare, which we personify. The meaning of Sentara, which is a word especially created for us, by definition represents the standard of excellence in healthcare. At Sentara, our mission is to improve health every day. Our values include people, quality, patient safety, service, and integrity. Our vision is to be the healthcare choice of the communities we serve. This couldn't be more true than here in the Northern Virginia market as we continue to grow our programs and services to meet the needs of our community right here close to home. At Sentara Healthcare, our strategic initiatives are focused on clinical quality and safety, customer centricity, which is putting the patient at the center of everything we do, and growth and innovation. Every member of the team agrees to uphold our commitments to our patients and to one another every day. Our commitments are always keep you safe, always treat you with dignity, respect, and compassion, always listen and respond to you, always keep you informed and involved, and always work together as a team to provide you quality health care. Sentara Healthcare has a 130-year not-for-profit mission. Currently, Sentara has 28,000 employees at 300 sites of care across the health system. The health system is comprised of 12 hospitals with 2,734 beds, 3,696 physicians, and 1,263 advanced practice practitioners. Other statistics regarding Sentara are up on the screen for your review. What you can take away is that Sentara Healthcare is a very large system and that Sentara enjoys a very strong financial position. Sentara Healthcare originated in the Hampton Roads market and maintains a dominant presence throughout southeastern Virginia. Sentara Northern Virginia Medical Center was the first out-of-market acquisition for Sentara Healthcare as they began their focus on growth. Following our merger, the hospitals in the Blue Ridge region, including Sentara Rockingham Memorial Hospital in Harrisonburg and Sentara Martha Jefferson Hospital in Charlottesville, also merged with Sentara. Halifax Hospital in South Boston, Virginia, and Albemarle Hospital in Elizabeth City, North Carolina, are also part of Sentara Healthcare. Sentara Northern Virginia Medical Center is proud to be among leading hospitals in the Commonwealth of Virginia and to be part of a nationally ranked top healthcare system. The Potomac Health Foundation was established following the merger of our hospital with Sentara Healthcare. Guided by an all-volunteer board of directors, the foundation provides grant funding to community organizations and programs focused on improving the health of our community, including those programs addressing social determinants of health. The merger resulted in a significant investment in programs and services at our hospital, including opening of the Sentara Heart and Vascular Center, the implementation of EPIC, our electronic medical record platform, opening of our ambulatory campus called Sentara Lake Ridge, and construction of a new surgical services facility, which opened in January of 2016. Numerous other facility renovations were also completed. The most significant benefit of a large health system is the infusion of capital, talent, and technology that a standalone hospital could never hope to achieve. That concludes my portion of this presentation today. Thank you for your attention. I'd now like to introduce you to Dr. Alice Tang, who is our Chief Medical Officer. Today, Dr. Tang will be presenting information about our emergency department and other clinical services at Sentara Northern Virginia Medical Center.
Hello, I'm Dr. Alice Tang, Chief Medical Officer at Sentara Northern Virginia Medical Center. I'm a practicing emergency medicine physician, and I welcome you to your onboarding. We provide emergency medicine services at 2 sites of care. The main, which refers to the emergency department here at Sentara Northern Virginia Medical Center, and Sentara Lake Ridge, which accepts walk-in patients 24 hours a day, 7 days a week. Our emergency medicine team is comprised of highly qualified clinical experts who provide acute, critical, and trauma services. The significant population growth in our community, our proximity to I-95, and increased incidence of violence, accidents, and serious injury created the need for a local trauma center. Through a concerted effort and collaboration, Sentara Northern Virginia Medical Center achieved Virginia Level 3 trauma designation in July 2021. The Heart and Vascular Center at Sentara Northern Virginia Medical Center opened in May 2011. Since that time, we have continued to build our program, expanding our capabilities and expertise in order to best meet the needs of our patients. The Sentara Heart and Vascular Center includes cardiac catheterization and interventional and vascular labs, in addition to electrophysiology services. At the Sentara Heart and Vascular Center, our clinical capabilities include cardiac testing and interventional cardiac services, including catheterization procedures. In 2016, Sentara Northern Virginia Medical Center introduced electrophysiology services, which addresses heart arrhythmias, or irregular heart rhythms, to our service line. Our Heart and Vascular Center medical team includes specialists and subspecialists in the field of cardiovascular medicine, many of whom practice at other cardiac programs. Our emergency department and cardiac teams work collaboratively with first responders in our community to ensure best possible outcomes for patients experiencing cardiac emergencies. Potomac Health Foundation grant funding supported the implementation of LifeNet in partnership with Community EMS for real-time transmission of EKGs from the field, allowing us to consistently provide emergent cardiac interventions within timelines significantly better than the national benchmarks. Overall, we have earned numerous recognitions for our heart and vascular program, but most importantly, we make a significant difference for patients requiring emergent and scheduled cardiac services. The Interventional Radiology and Peripheral Vascular Lab operates in partnership with a highly skilled group of interventional radiologists who are trained to perform minimally invasive procedures to address a wide variety of diagnoses. Sentara Northern Virginia Medical Center is a DNV certified primary stroke center, and through the American Stroke Association, we have achieved recognition as a certified stroke center Gold Plus Award, their highest rating, by instituting best practice and leveraging technology to expedite time-sensitive care to patients experiencing stroke.
Hello, my name is Christy Gravis. I am the Chief Nursing Officer here at Sentara Northern Virginia Medical Center, and I'm going to guide you through the next several slides. Sentara Medical Group provides telemedicine capability for psychiatric consultation services for the care of behavioral health patients, boarding in the emergency department, and consultations for inpatients as requested by the inpatient care team. In our commitment to improve health every day, Sentara Northern Virginia Medical Center continues to work with our community partners to expand access to outpatient behavioral health services. In collaboration with Youth for Tomorrow, with generous grant funding provided through the Potomac Health Foundation, new outpatient sites of care have opened, with plans for additional locations underway. We are proud to be a part of the Sentara Cancer Network, a designation we earned through the development of a broad scope of services for patients diagnosed with cancer. Our program includes a team of specialists and subspecialists, a full scope of clinical services, and the robust support services provided through our Cancer Resource Center. Through our cancer program, we offer focused services for women's breast health, including our beautiful mobile mammography unit, funded by the Potomac Health Foundation, which supports awareness and outreach to provide annual breast screenings. All of our sites for our mammography offer 3D mammography, also known as tomosynthesis. We are proud of the many accomplishments in our cancer program, including numerous awards and accreditations, the launch of the cardio-oncology program, the introduction of PET-CT services at the Century Medical Building, a streamlined direct admission inpatient chemotherapy process, and our Sentara Cancer Network Resource Center. Our beautiful center is also located in the Century Medical Building as we bring these services together for the convenience of the patient. Specialty-trained oncology nurse navigators support patients from diagnosis through treatments to survivorship, connecting patients to providers and providing services and support. At the Women's Health Center, over 1,300 babies were born in 2020. Our Women's Health Center is secured with a state-of-the-art infant security system and includes 9 private labor and delivery rooms, 2 dedicated ORs, 27 postpartum rooms, and a 14-bassinet nursery with a Level 2 neonatal ICU. Neonatology services are provided through our partnership with Children's National Health System. We offer a variety of education programs for expectant parents and grandparents, as well as a nurse navigator for breastfeeding and postpartum support services. In January 2016, we opened a new state-of-the-art facility offering full-scope surgical services, including Da Vinci robotics and specialty navigation for orthopedics and neurosurgery. We are supported by a complement of surgical specialists, including neurosurgery, and offer specialty procedures including aquablation therapy for BPH and LINX for GERD. Orthopedics is a comprehensive program including total joints, spine, podiatry, and trauma services. The total joint, spine, and foot and ankle programs have been deemed Sentara Centers of Excellence, meeting stringent quality operations and patient education criteria. Our total joint program covers all subspecialties, including knee, hip, and shoulder replacements, and we recently added total ankle replacement to our complement of physician services. Our orthopedic navigator works with patients, guiding them from preoperative education and surgical preparation all the way through their discharge.
Hello, I'm Val Keene, the Vice President of Operations, and I'm proud to be part of the hospital for more than 33 years. The Outpatient Wound Healing Center is conveniently located in the Potomac Center and includes hyperbaric oxygen therapy services. At our outpatient therapy centers, patients are provided a variety of therapy services to augment healing and wellness, including chiropractic and alternative therapies. Locations include the Century Medical Building, Reed's Prospect at County Center, and Stafford, with a new office location coming soon to Dumfries. Our integrated care management team is multidisciplinary and includes registered nurses, medical social workers, and other consulting professionals who collaborate with the patient, family, and clinical team to understand and plan for the patient's needs beyond their acute care hospital stay. The goal is to facilitate the transition of care, whether the patient requires rehabilitation services, skilled nursing, or will be heading home following a hospital stay. Sentara Medical Group's doctors, physician assistants, and nurse practitioners are ready to provide you with the highest level of personalized, quality care. Sentara Medical Group utilizes Sentara eCare, electronic medical records, providing patients access to their health records through Sentara MyChart. Sentara Medical Group in Northern Virginia offers numerous sites of care in Woodbridge, Lake Ridge, Dumfries, and Stafford, and includes primary care and surgery specialist services. Velocity Urgent Care is a partner with Sentara Healthcare with a location in Woodbridge at Port Potomac. Although things were put on pause during COVID, at Sentara, we take pride in being engaged with our community, providing outreach, health screenings, participating in community events, sponsorship of the Potomac Mill Milers Club, and raising health awareness. We engage in many different partnerships to enhance the overall health and wellness of our community. At Sentara Northern Virginia Medical Center, we live our mission. We improve health every day. On behalf of leadership, welcome aboard. We're glad to have you as part of the Sentara team.